Welcome, Dr. George Zlupko, and you are with Physicians for Emergency Services and Christiana Hospital, and I cannot tell a lie, you're my neighbor. So I do appreciate your coming because I thought it was very important for us to check back and find out how it's going at ground zero in our hospitals with the uptick in COVID. Can you tell me what you're seeing?
Yeah, so at all three facilities with Christiana Care, the Middletown ER, the Christiana Hospital ER, and the Wilmington Hospital ER, the numbers are up. There are people coming in with complaints, worrisome for COVID. We're doing a lot of testing for COVID. We're finding much more COVID positive patients now than we were the last time we talked, which was several months ago. And the hospitalizations, as in today's paper, if you read the news journal, hospitalizations for COVID are up. So
Okay.
that is true.
Literally, how are people presenting? You know, we hear about the symptoms, it's respiratory, but I've also read that it can present as a lot of different things. What are the most common symptoms?
Yeah, so there's a couple different presentations that we're seeing over and over and over again. One common presentation is someone feels like they have a GI bug. They kind of get over it after a day or two, and then a week later, they start getting symptoms like sore throat, cough, and shortness of breath. We have people coming in with a constellation of symptoms, which is I just feel weak and tired when I walk. I just have no energy. They'll have a headache. They may have some nausea with or without vomiting, with or without any diarrhea. The common symptoms, though, seem to be eventually shortness of breath, either at rest or with exertion. They call that dyspnea on exertion, or shortness of breath with exertion. And that usually ensues after those other symptoms that I mentioned. You may have fevers and chills, you may not, you may just feel hot, but all those things, sore throat, headaches, malaise or loss of energy, and then some GI symptoms, that usually starts the process, and then it'll move on to I'm just feeling now more short of breath, coughing, things like that.
Okay, I have now known several people who have had COVID.
Yes.
Including family members.
Mm-hmm.
They were on the younger side. And the symptoms were pretty mild and they got over it pretty quickly. Is there any kind of a norm? I mean, two questions. If you're in a household with someone who tests positive, does that mean you're going to get it, A? And B, if you're over a certain age, are you guaranteed to be worse off? Or, you know, are people at all different levels of illness?
Sure. I think if you're in a household with someone who has known positive COVID test, you do have a higher risk of contracting it, primarily because you were probably in close proximity and sharing a living space with that patient before you knew they were positive for COVID. That usually seems to be the scenario.
And George, what is that time frame?
Well, as I mentioned, from the time people start getting some mild, vague symptoms of either headache or nausea or some mild GI symptoms, and then a week later, they'll usually present with some shortness of breath or things like that. So we're talking days before they get their mild symptoms of I have a sore throat or I have a headache. Days before that, when they're asymptomatic, if you're sharing drinks, if you're sharing a living space, if you're close in with them and not in a well-ventilated space, I mean, you're exposing yourself to the virus. And we are hearing more and more people coming in, this recent uptick of patients coming in. We are asking, is anyone in the family, have you been exposed to anyone who has known COVID? And we're getting more and more, yes, my wife, my spouse, my child, an aunt, an uncle, something like that. It seems to be the story.
Do some people just not get it? Are they somehow protected or immune naturally?
I think these are great questions because, for example, there have been emergency physicians, emergency residents, nurses, physician assistants, all of us working on the front lines. Some of us are getting it. Some of us aren't. Why is that? Don't know. The good news is, at least speaking for the physicians, the physician assistants, and the residents, they had their symptoms mild. They were mild symptoms. And they're back at work now after being either treated or quarantining and stuff like that. So over the past several months, we've had people come back positive. But why is that some people seem to get it? I'm working in the same environment as my partners, and I have not yet gotten it.
Right.
I don't know why that is.
And, well, you're blessed and you're lucky, and maybe you've got a strong immune system, but is it, and I'm also confused, and I'm sure our viewers are, with, I've heard people say, in fact, my hairdresser canceled on me. She said, I've got COVID. I've already been in 7 days, but they're telling me I need 14 days of quarantine. I don't know why. Thus and such only needed 7. I'm not even sick. It's very confusing for people.
Yeah, I do think people like Dr. Fauci and the CDC, they may have changed things slightly as far as quarantining to 10 days from the 14 days, but they are recommending it right now. I mean, just so you don't give it to other people, even if your symptoms are mild.
Right.
You just don't know who's going to get really sick with it.
And that just depends on many things, right? Underlying conditions and okay.
Correct. Now, but I also think that the jury is out as to why some people just get really sick compared to others. I don't think we know. I haven't read anything from the virologists or the CDC. I mean, we're talking about people who have comorbidities like asthma, emphysema, people who are older, pulmonary hypertension, pulmonary fibrosis, lung disease, heart disease. I mean, we're talking about people like that. However, why are some people just getting horribly ill? Why are some young, healthy people with none of these comorbidities getting ill?
Right.
I don't know.
Well, let me jump to my next question.
Okay.
Which is really, how are you and your team faring? And this is what makes me so angry when I see people who are casual or outright refusing to wear masks. They are in denial about the pandemic. Not a lot, but enough, when you and your team are risking your lives. How is it going? What are you observing about our healthcare workers here in Delaware?
The ERs, the local ERs are brimming with patients. Time to be seen is long. Time spent in the emergency department waiting for bed is long. And I will just remind everybody that this time of year, anyway, without a COVID pandemic, the hospitals can be very busy with the usual things, flu, pneumonias, infections, strokes, etc. So winter time in general is a busy time for the hospital, a busy time for the emergency departments. But adding on to that, the concerns for COVID and the numbers of people who are presenting with the constellation of symptoms that I've described, it can be overwhelming to the system uh, with just long waits to be seen, no room at the inn, so to speak, for people who are trying to get care or who are sent there for care, et cetera. So it's very busy.
And your team, though, you're managing, nobody is, we've seen, photographs and video of doctors and nurses sleeping on floors in break rooms, utterly exhausted from, this intensive, constant care.
Yeah. Well, I will say that it's putting a stress on our nursing staff and our physician staff. As I mentioned, luckily, none of our I'm ignorant about all the nursing staff. I haven't heard anything bad, but at least for the physicians, residents,
Sure.
physician assistants, no one horribly ill. People who have contracted it, but no one horribly ill. But it is taxing on our system. People who do get sick, people have to call out. Then we're down staff, people then working doubles. The nurses I'm speaking of here. I will say this too, my brothers and sisters who are working in the intensive care units, a lot of times that's what you're seeing on the news. And they are, I hear stories. I don't work up there, but they are very busy with this onslaught
Sure.
and this uptick of COVID patients. They are very busy.
So, short of an acute situation, there's not much you can do for COVID, is there? I mean, isn't it liquids, rest, isolation? Help us understand.
Well, so just for the public, one of the metrics, so people will come in, we're highly suspicious of COVID. Maybe we even know they have COVID from a test that either we did or they had done recently. Certainly one of the metrics we're looking for on the patient is whether or not they are truly, besides feeling short of breath, are they also hypoxic? Do they have a low oxygen level? Do they have a new oxygen demand, which is correlating with their shortness of breath?
So it is primarily respiratory then.
It is. It's one of our biggest metrics. Obviously, too, we're just looking at the patient themselves. Are they horribly sick with a low blood pressure and a fast heart rate? Are they delirious? Some of these older folks or people who are very sick coming in with COVID are presenting with change in mental status. They're a little confused. That seems to correlate with their hypoxia or low oxygen levels, but it also correlates with their low blood pressure, their fast heart rate. They're just, they're sick with this disease. And so they can also present as I'm weak and they're a little out of it, they're confused. So.
Two more questions. So for those who are unfortunate enough to contract it, but fortunate enough not to have a severe presentation,
Yes.
Is it stay at home, isolate,
Yes.
Liquids and rest, and what is it?
Right. So for some that we know
Then I have one more.
Oh, okay. For some who we know are COVID positive, if they have known underlying lung disease, for example, if you're an asthmatic or you have COPD, emphysema, and you have COVID, but we did not identify any low oxygen levels or hypoxia, and you seem to be doing well otherwise after we evaluate you, you are able to go home with precautions for returning, but we may put you on steroids, anti-inflammatory steroids, drugs like dexamethasone, prednisone, methylprednisolone. These are steroids to help your lungs, but we would do that anyway with folks who came in who had a bronchitis or pneumonia.
Sure.
But that's one treatment that these people can get as an outpatient. The other thing we are offering these people is we have a monoclonal antibody infusion, which is an IV medication which is supplied to us by the federal government. And it is reserved. We have limited supply, and it is reserved for those people who are not sick enough to be admitted to the hospital, but who have a lot of underlying lung disease, who may benefit from getting this IV infusion therapy, which is a one-time dose. And if we identify those patients, we in the emergency department are we reach out to a hotline within the hospital, and then that hotline, those workers see if this patient would qualify for this therapy. Again, we have limited supplies of this monoclonal antibody infusion therapy. So that's something that people can get. But you're absolutely right. The other things are treating this, plenty of fluids, keeping your fever down, isolating and making sure you're not getting anyone else sick, staying healthy, eating well, etc.
Okay, gosh, we could talk all night long. Let me just get one more, and then maybe I can get you back in a week or two or after the holidays. If people have had this virus and they've successfully come through it, is that it? Or now do they have immunity, or can they?
Well, I think from the things I'm reading about this, the Pfizer and soon to be hopefully the Moderna vaccine, first of all, if you can get vaccinated, even if you think you had it, I think the recommendations are that you are still supposed to consider getting the vaccine. There is probably, from what I'm hearing from the virologists online, there is probably some degree of immunity, just like if you got the flu and you went through it, you'd probably have some limited immunity antibodies that you made over a certain period of time. But what that period of time is it a month? Is it 3 months?
Yeah.
Is it 6 months? So they are still, in what I'm reading, because we're just getting ready to roll out vaccines for healthcare workers at the hospital, they are still recommending that even if you had COVID, to still consider getting the vaccine when they are available to the public, et cetera. So.
Well, the bottom line is wear a mask, wear a mask, wear a mask, wash your hands, and keep your dang distance, huh?
Yeah, I think we are the thing that I'm feeling, and the thing that a lot of the people are feeling in the department, is that we are so close. We are so close, and we're not above the fatigue of all of this. We've been doing this for months now, wearing masks and socially distancing and not traveling and et cetera, and being careful with your family and being careful in your house and showering all the time and not sharing food and et cetera. And there's a lot of fatigue there, but we are really close now with these vaccines, and everything that they're saying on television about, even though the vaccine seems like it's like a panacea, it's going to be like the cure, the magic bullet, we really have several months to go, first of all, till everyone gets vaccinated, and to continue wearing masks and socially distancing to really protect everyone in the community. Yeah.
Dr. George Zlupko, thank you so very much. And I'm going to get back with you after the holidays.
Okay, well, my pleasure, and Merry Christmas and Happy Holidays, everyone.